So Andrew and Paresh asked me to make a few concluding or summative comments to today's presentation. So what you've heard Andrew and Paresh talk about today is the extent to which a multidisciplinary transitional care plan can be advanced and the important elements of that. And those are four areas: the importance of information transfer and getting that right, the importance of medication management and having a plan for getting that right, care coordination and getting that right, and the importance of having access to the right array of step-down services in the community in aged care settings to aid effective transition from hospital to home or an aged care facility. What we've talked about is also a reminder about the WHO report, that seminal report that reminded us that primary care, it's about that now more than ever. And our other key message, and the key message of the WHO report and other commentators, is that high-performing health systems are those that have a strong primary care backbone. If we're to better manage transitional care, we've got to have investment in primary health care responses and robust responses in that setting. We know in Australia, and this is common to most other countries as well, that people find our health system extremely hard to navigate. The common experience of care is one of fragmentation and disconnected care. And we can't stress enough that the point where that's felt most acutely is when people are transitioning between care settings. So our message to you today is that this is where the patient-centred healthcare home comes in. That and its key ingredients are care coordination and an enhanced level of consumer involvement. But most importantly, under a healthcare home model, the key point of accountability must be clear. Who is responsible for follow-through on transitional care plans? And I think that's really important. When you've got a transitional care plan in place, it's often left ambiguous or hanging or unclear about who it actually is that has responsibility for following through on that care plan. Ultimately, it's the patient, but with the assistance of their primary care provider to whom they have been discharged, their primary health principal care coordinator located in a healthcare home, single healthcare destination. From a consumer perspective, we've got really high expectations and we've set an ambitious agenda for healthcare homes in Australia. Our government policy is certainly a step in the right direction, but we need to remain ambitious about where we can go with this. We need to transform primary healthcare, and we certainly can draw from learnings from other countries who are well down the path of implementing and introducing patient-centred healthcare homes. Our reference point, certainly at Consumers Health Forum, and I know many other commentators like this model as well, is Bodenheimer's 10 building blocks for high-performing primary care. And our main message, and my main message as a consumer healthcare advocate, is that any implementation program for patient-centred healthcare home models must pay attention to all building blocks. Sure, we need to look at how we need to finance and fund general practice and primary healthcare providers to behave differently and to organise their services differently, but equally we've got to pay attention to self-management, supporting patients with and empowering patients with evidence-based self-management programs so they can do as much as they can for themselves in the home and with their families. We need to invest and support patient leaders so that they can co-create services that optimise patient experience and insight, working alongside clinicians as co-producers of better models or enhanced or improved models of care. We need to use existing workforce. We are workforce rich in Australia. We've got highly skilled primary care and specialist workforce, and that means looking at the role that emerging workforce should have and could have in patient-centred healthcare homes, workforces like service coordinators, health coaches, but up the other end of the spectrum, thinking creatively about how we might use specialists currently working inside the hospital walls, how we can get them working in different ways, working outside of the hospital walls as part of an extended care team, as liaison, advisors, counsellors to GPs. We need infrastructure, shared records and shared decision making. We've got to get healthcare information in the one place at the right time so it's portable, so that we can better connect up healthcare information. And shared goal setting is very important. So really, the shift to patient-centred healthcare homes, when you think about it in the context of those 10 building blocks, and some of the building blocks that are sometimes the forgotten building blocks from a patient perspective, it's as much about driving cultural change as part of primary healthcare transformation as it is about a new model of care. So for real success, consumers must be the agents of change. They can be the makers and shapers of progressive primary healthcare transformation in collaboration with clinicians. And I hope we're demonstrating that today by talking to you as a panel, if you like, of clinicians and consumers from the Australian context. And what we want to see translate down into local work on healthcare improvement at a general practice level, at a primary health network level in our country, is consumers working with clinicians to describe what doesn't work in transitional care and what combination of people, services and settings need to be in place. Wherever we consider the potential advantages in the consumer-clinician relationship, we can see scope for shared improvement, like building better data about patients' experiences in care transitions, working together to set targets, working together as clinician and patient leaders to evaluate and address the needs of all stakeholders, like exploring the development of a requirement that healthcare organisations and professionals verify that they have sent, received, read, acted upon a discharge summary, working together to develop incentives, including financial incentives, that appropriately change or stimulate the behaviour of all involved in transitions of care so that we can get it better designed, better targeted, better directed to avoiding some of those consequences and concerns we've talked about earlier in the presentation. So I think the key message is patient-centred healthcare homes are vital, timely, probably overdue healthcare system improvement in Australia. They provide us with a real solution to tackle some of the endemic and entrenched issues and challenges we've experienced with transitions of care. And mixed into all of that is the need to really make real patients as leaders and co-creators of a better system. We've got the opportunity to do that now as we start our next leg of our primary care transition journey, or transition and transformation journey. Thank you very much.